Dr. Maimele, good morning. Welcome to the show.
Good morning, Katlego. Thank you so much for having me on your show today. Good morning to the listeners, and how are you guys this morning?
All good, all good. Can't complain. Still in good health, would like to believe, but really, really appreciate you giving us your time this morning to reflect on these spaces. So, an all important space looking at where we come from and where we find ourselves today.
First of all, I'd like to say that South Africa and the health system where we are at in these days, or the burden of disease in our country, is that it holds a unique nature in the sense that we're still the distribution of the burden of disease that we're faced with is that we're still grappling challenges related to HIV and AIDS, tuberculosis, high maternal mortality, as well as child mortality, as well as a rise in the burden of non-communicable diseases. And at the same time, we're also faced with high levels of trauma and violence. And just to comment on the progressiveness of the system despite its challenges, I want to reflect on a video that I saw on social media over the past few weeks of an American trauma surgeon that came a few years ago to come and do an elective at Kwesani Baragwanath Hospital. And in this video, he's really talking a lot. And, well, if you see the video, he really speaks a lot about the challenges that our health system faces. But what I like is his appraisal on how, despite all of this, doctors and people working in the healthcare system are doing the most to make the best of the resources that they have. And in this video, he describes basically an intervention, a life-saving intervention that he had to learn, that he learned to do here in South Africa as a student, but he learned to do in South Africa. Basically, when you're shot and then you have a penetrating trauma to your chest, we have to insert what we call an intercostal drain. And in places like America or in first world countries, doctors only get to do those type of things as senior clinicians, and we're taught here in South Africa as students how to do it. So I found it so interesting how he could really look back and talk about the Soweto way of how to tie an intercostal drain, and I'm like, you know what, we're doing well. Like, our teachers are doing well to teach us how to deliver great healthcare services with the resources that we have, how to become pioneers in healthcare despite the challenges that we have. And I think for me, those type of notions and narratives or leadership in healthcare education teaches us to go away with narratives such as we're practicing rural medicine. No, we're practicing medicine with the first world class medicine with the resources that we have to provide appropriate healthcare for our patients.
And one really, when you look at it, would say that the space of medical healthcare has always been a revered space. It's always been one of those spaces whereby we know very well that you deal with a lot. With a little that you have. I mean, it has been a long-standing view that hospitals would get an influx, especially when you look at public hospitals. You've mentioned as well that over time, we've seen the country navigating waves of HIV, AIDS, tuberculosis, and the likes. But we still see these men and women coming through and showing up amid all of these challenges. When you were speaking now, I'm taken back to how some of the facilities would not even have the basic of services, but you see the doctors and the nurses just pulling through to ensure that they, practice. They try by all means to apply all of these tricks, right, to safeguard this life. That healthcare education becomes very important because of the fact that you will need then to be resilient amid all of these, challenges because of that principle of Batopele.
Indeed. And the thing about the challenges that we're faced with in our healthcare system is that we need to remember that there's an unequal distribution of resources in the sense that it's only about 20% of our population that have access to medical aid and private healthcare. And that means that public services then have to cater for everybody else. And the system itself is overburdened and under-resourced. And yet alone, we cannot even begin the conversation of when the resources are then allocated, where do they go? But the cumulative effect of this then leads to understaffing, long waiting hours, poorer outcomes, higher mortalities or morbidities. And even in terms of training, I think that there was also a recent, about 2 weeks ago, our president went to go visit Steve Biko Academic Hospital. And there is a short clip, I think, that was also posted on social media whereby he's speaking to one of the cardiologists or two of the cardiologists at the institution. And even him himself was struggling to understand that the way things are and the resource allocation in our country, the budget is now unable to train specialist physicians. We are unable to now, with all this great knowledge and all these expertise that we've gotten to learn from the type of diseases that we're faced with, we are now unable to train people. And if the president himself is struggling to grasp or understand, like how that can be broken down to everyday level, I think that like our chances are way bigger than what we can understand. And more than anything, with now challenges relating to human resources, there's a lot of unemployed junior doctors, but more than anything, there's a lot of unemployed senior doctors, specialists, and what this means is that doctors will leave the country, and that will contribute to the brain drain, that will contribute to having less skilled workers in our country.
It's something else that is a scary reality. There was a point, Dr. Maimele, when we saw even graduates in the medical space taking to the streets to talk about the lack of opportunities. At the same time, when you walk into any public facility, you get a sense that there is a shortage. And one then looks at the disconnect to say that how do we actually find ourselves here? Those austerity measures, they tend to then take away from even the skill set that we have here. Like you say, we can't afford to lose these skills to other countries, but that the reality of unemployment and a stagnant economy that does not accommodate them would then see people going to seek for opportunities elsewhere. At the same time, I mean, we do have those programs. What is it? What is that country where we take the doctors, they go get trained there, and you get a sense as well that in this training we do expect then for them to feed back and ensure that they solve for the country where medicine are concerned. And this becomes also a space that should be a priority space because of the fact that you're dealing with life. But we would have to agree here that over time, the austerity measures have taken away from ensuring that you solidify this space and you ensure as well that it is as prudent as it should be, looking at the skills that and the investments that you've put in these young doctors and nurses.
It's actually quite sad, or rather even disappointing, that we're training so many young doctors. We're planning on opening more medical schools, but I'm not sure what we're going to do because a lot of money is put into training a doctor, yet they're left unemployed due to the austerity measures. And so I think ultimately the cumulative effect of that is that a lot of doctors will leave our country, even though we've invested in training them. So we really need to come together with different stakeholders and people in different professions, whereby we solve the health crisis or the health problems, not just from the perspective of medical people, but really employ an interdisciplinary approach to trying to solve these problems.
It's just a cause for concern here. But a reminder to our listeners at home that we're talking health matters. And this morning we're joined by Dr. Kulani Maimele, who's coming through as a pediatrics registrar at the University of Pretoria, helping us make sense of all of these developments and taking stock of where we find ourselves in terms of 31 years of democracy where the country's healthcare sector is concerned. It's not a rosy picture. It's a beautiful space in terms of the profession and how people go into it with so much much heart because they would want to save lives and ensure that they improve the quality of life of those that are on the ground. But this myriad and a mammoth of challenges that they are experiencing on a daily is something that then takes away from these space. The lines are still open. Let's hear from you in terms of how you're receiving us this morning. I see Angela calling in from Pretoria. Like Angela, you're welcome to form part of these conversations so we can reflect here with Dr. Kulani Maimele, your observations in terms of how this space has fared over time and what then would need to be done. There are times here, Dr. Maimele, when you'd hear people talking about the unprofessional behavior that would come from some of the professionals that are there, but looking at the flipped coin or the other side of the coin, you'd hear people saying that here you have nurses, you have doctors that are overworked, that are going through mental issues because of what they experience on a daily. Most of them don't even have time to debrief and sit down and talk about how things, all of these issues have affected them. I mean, we have nurses that are struggling in terms of their legs. You know, I have an aunt who, eventually had to sit down, because of her legs. She couldn't take it anymore. The up and downing, and she ended up developing a challenge with her legs. And you hear that this becomes a reality for most of the nurses, which is why then you hear people saying you need to have some level of understanding and maybe give them somewhat of grace because of the day-to-day challenges that they are experiencing, that maybe the naked eye, or because you are frustrated, you're a patient, that wouldn't be your first thought to have somewhat of grace here because of the challenges that then the next person that is helping you is going through as well.
Absolutely. I think that another thing that we never really think about is that healthcare professionals are actually looking at the face of death every day. And to one person, that's like perhaps something that happens to you in your life once in a while. Perhaps you lose a loved one here and there. But with us as health professionals, death is staring at us every single day. And we are here to prevent that and to employ most of our energy to try and ensure that we provide the services that ensure that you don't get to lose your loved one. And I'm saying that because it's not an traumatic experience. It's very traumatic. And I think as healthcare professionals, when we speak to the mental health of healthcare professionals per se, they're faced with burnout, they're faced with PTSD. I know during COVID, there's a lot of my colleagues who post-COVID really couldn't step into certain spaces because so many people died and nobody came back to healthcare professionals to say, are you guys okay? Yeah, and with overstaffing, it also means that we work long hours, and that also contributes to burnout. And often symptoms of burnout really do express themselves as people being snappy, people not being able to regulate their emotions and seeming a little bit offish. And that's maybe the parts whereby patients are in the receiving end of that. I'm not saying that it's correct and it should be accepted, but I think that yes, we should ring the alarm when we see healthcare professionals and we think they are struggling in that regard. Even as patients, I think that it's an important thing to report because it's easier for us to overlook that healthcare professionals themselves are also humans.
So there is that opportunity to say, "Hey, Okara, how sharp?" Dr. Maimele.
Yeah. Are you okay?
Are you okay? Are you sure? You know what I mean? Just check in a bit. I think that would really go a long way. Angela, you're calling us from Pretoria. Good morning. Welcome to the show.
Morning, Katlego. We are happy also you are back. Greetings to the doctor.
Thank you very much, Angela.
And greetings to everyone who's listening. Katlego and the doctor, I'd like to just say that I was born and bred here in South Africa, in Soweto. In fact, I was bred in Baragwanath. So I grew up during that time, 1976. That's when I was born. And I'm telling you, South Africa, Soweto, in fact, in particular, let me go down to Gauteng and Soweto. Baragwanath was the best performing medical center when she talks of the doctor from US who came there and she was giving praise, we understand that. However, it's what has always South Africa has been proud of. That's what South Africa has been proud of. We know quality. We know quality. We've experienced quality. And it's very sad what we find ourselves in today. You are talking of the Bantu Pili principles and the doctors of late when they are interviewed about this overburdening of the system, influx of illegal immigrants from outside. They are standing as the health sector through the principles of saying we are out to give service. That's what we are trained for. We understand that. However, these challenges that she's citing now, that they are facing, we also don't feel the quality of our doctors that they've been trained for, that are supposed to be servicing us. We don't feel it. And when they start crying like this, these doctors, it's a sad situation where you find a division and a big gap between the people who are supposed to be servicing us and the community who says, you know what, we voted for a system in this country, a government who is supposed to prioritize us as citizens because we vote them in power. It's such a sad situation where you look at a health sector not like you used to look at them before. My firstborn, for example, is a medical doctor. I know exactly what they're undergoing. So it's such a sad situation
Is it
where
the politics of the day that maybe have taken over, that maybe probably has been prioritized over time compared to the basic delivery of services that would also help you and I and also the doctors as well? Is it the politics as engine?
It's the problem of us as the voters, as the constituencies, as the people on the ground. You know, when ANC started in 1994, everything was fine. You could see the old man was really trying. Whoever blames the former president, Nelson Mandela, really, I have a problem because we read the policies, we voted them in power because we could see these people are coming with a change. So there was that in his first term. And he was old, he had to retire. However, the communities themselves, us people, we are supposed to reach a stage where we say, you know what, these people are no longer servicing us, giving us mandated what they are mandated to do. We need to see that. We need to see that. We need to tell them, here, this is our platform. We utilize this platform to convey a message. We utilize these platforms. We have power to utilize this platform so that everyone who's listening at least get that perception, get that information. That is a change of a mindset because we need to reach that level where we say, you know what, we've tried. 30 years is not enough. 30 years is not enough to make a change. We have to make a change. We must see with who we are today as compared to what we know before. Once you start seeing that, these people are we are no longer aligned. They are no longer giving us what we expect, what we voted them for. Let's move them. They are tired. In fact, they are no longer, the corruption, when he was talking about the health sector, I'm just trying, he is addressing the medical sector side. But the corruption is on the commercial side, the procurement section. So you can see that the departments, they are not aligned. They are not working together for the common cause of servicing the same community that they say they care about. Guys, we need to reach a stage where we say, you know what, we care. We've tried to care. We've opened the borders, not intentionally, but somehow we found ourselves with this government who doesn't know what they're doing. Either they know they just want to collapse the country. But fortunately, with the democracy that we have in this country, we have to utilize that. We have to utilize that in such a positive manner that everyone in this continent can learn. We have to preserve what we have. This is the only country we have, guys. We have nothing. If there's only country that we can run to when everything collapses here, it's Botswana. It's very small. It can't take care of the whole South Africa. We can't go to Zimbabwe. We can't go to any other country in the continent. We don't deserve such. Guys, we don't deserve such.
Yeah.
But if we don't stand up all holistically and support a common cause, like we did support the common cause when we voted them in power, we have to remove them, guys, because we are having a health system where the human capital is dying. These kids are crying. He's crying. She's crying. She's telling us that, guys, we are not coping. And I'm saying to South Africans, guys, we know better. We've experienced better. We can't lower our standard now to where we are. Thank you very much, guys. Thank you.
Angela, really, really appreciate it. Angela calling us there from Pretoria. Dr. Maimele, what do you make of what she touched on there? I think two things stood out for me. One would be the issue of foreign nationals. And I'm sure you've seen this campaign that has started around just more or less ensuring that there's compliance. But again, corruption and how then it's robbing and taking away over time, from this particular sector, even going to a point of saying that maybe at this point in time we need a reality check of some sort, because the politics of the day, as much as we utilize them and we transitioned, maybe it's time that we regained and use that X for the greater good in ensuring that we bring about change. What do you make of that, Dr. Maimel?
Oh, she said really important comments, and I'm so thankful for her passionate and candid perspective. And I think, as she said, that her son is a doctor, I can really stand back and say, thank you, Mama, because you guys can see that it's not easy for us. And so as patients, they do come, as a patient would really walk into a facility and they're faced with long waiting times, they're faced with overcrowding, they're faced with poor service delivery. But actually, those type of issues are actually, they boil down to corruption. We have been trained to be exceptional doctors. South African health training is not mediocre. That's the thing. We have been trained so well, yet when we are faced with patients, what we can deliver is only what is within our access. And we are not the ones that are procuring the resources. We are not the ones that are ensuring that the drips are there, that the medication is there, that the things that need to be there are there. And then when it comes to issues such as foreign nationals, I work in pediatrics, and I think in pediatrics and maternal health, we are in a very unique position that it really has been brought to the law that we are unable to refuse care to lactating mothers and pregnant women and children under the age of 6 years, simply because that health is a human right. And as I mentioned, we are also doctors. So what does it mean for me to see a child who didn't wish to be here struggle? So even for us, we ourselves as doctors were challenged with the fact that in our units per se, in certain units where I've worked in, a unit would maybe be housing, the infrastructure would be made in such a way that it can only have about maybe 20 babies. And a good 14 of them would not be South African. And more than anything, it's not that the unit actually has 20 babies in it. We probably have 40 babies in that unit.
Yeah.
With the resources that are there, that are actually only have been distributed to cater for 20. So it's a very long conversation to be had. But
it's another one. It hits home for a lot of people. I see people also calling in. I'm sure, I think, it's something else. It does hit home. But I wanted to, before I let you go, Dr. Maimele, just find out from you. We know very well that the buzzword, and in terms of all of these issues that have been playing themselves out now, would be the national health insurance at the moment. And we see different views around the NHI. A lot of people saying that it's coming through to this, insurance will come through to balance the playing field, to help where we can, and to also also helps strengthen community health care, looking at where we find ourselves today. Maybe do give us a sense of what your understanding would be of the opportunities that would be presented by the NHI, or whether this is one of those issues whereby when you look at it, it's still going to be a long way to go, looking at some of these mammoth of challenges that we've highlighted.
In terms of the NHI, I think that the idea behind it is actually exceptional in the sense that the whole aim is that we want to achieve universal health coverage, meaning that everybody should have access to health care. And I think that the greatest challenge that is coming from the NHI is that we don't know where the funding is going to come from. And the funding is said to be something that will come from by the government and from our taxpayers. And I'm not sure what are the steps, or how are we actually going to practically implement it, and what is that going to look like? And I think that that's what's causing the greater disgruntle amongst the people, is that we're here, we have a public health system that is funded by the government, and in terms of the infrastructure and the resources that we have, we're actually struggling to provide care for people. But one thing I can also say and commend is that in the spaces whereby we are working in, I know for instance, in most institutions, we're now moving to more digital systems, and we're trying to upscale our service delivery to keep up with the current technology of things. So there has been moves and strides to try and ensure that our public facilities themselves are able to provide the quality care. But I'm not sure if, as a whole, we would have actually captured or transformed most of the spaces. Another important thing that comes to the National Health Insurance is that it's strengthening the primary healthcare system. And I think that we are also currently, that is one of the aims and goals of achieving universal health coverage. And I think that it's a longer conversation. And I mean, politicians have spoken endlessly about it. Everybody's disgruntled.
It's even in court, you know what I mean?
Yes. Yeah. So I don't think that I think it's not just an individual's opinion. It really boils down to the practicality of the matter. And even though the heart behind it is good, I think we really have to sit down collectively to plan out how are we going to do this good thing, which is provide universal health care coverage and achieve the SDG goals, actually.
Oh, yes, there are those goals as well. Very important. But Dr. Kulani, you are our hero, really, more than anything else. I love the candidness, that you came with. You approached this as well with so much care and grace. And I guess this is what then would flow into various of these wards where we find you as well. But you're not alone. You had Angela as well. You're not alone. We are aware to the challenges that you guys are experiencing, and as much as we continue to see the challenges playing themselves out, you show up, you save lives, and you ensure that you practice as much as you can. We really, really appreciate you. Don't leave the country, please. Stay here. We still need you, and everything of the best in your journey as well, and the colleagues as well. I know it's not an easy one, but I know at the same time you hear people saying it's a fulfilling one, because you wouldn't then keep going back when it doesn't serve you somewhat. We really, really appreciate you, Doctor.